all the interns from St. Gregorius Social Service School from Kerala. So this is our first Zoom session today. And I will start sharing my screen so that you can. Oh my God, a lot of my windows are open. Just give me a minute, please. Are you able to see my slides, Freddy?
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Okay, great. So let us start with our session today. So along with PHARM Foundation, Kairos Kinetic, we are conducting the first webinar for you today. The title is Introduction to Eliciting Case History and Communication Skills for Social Worker. So this is our topic, but as we discussed, tomorrow we may be getting our hands on the case performers, but today let us dive into what is this topic about. I planned the session for around 60 minutes, probably. We will see how far it goes. So I want to give a basic introduction for you. What is medical social work profile? What is the scope of your work so that you'll understand how elaborate, how interesting, how meaningful this course actually is. And based on the case pro forma that you'll get your hands today, I thought we'll have some discussion about how to proceed with case history eliciting. But yesterday we had a preliminary introduction. So tomorrow, maybe Nila will help you get your hands on that. So based on today's discussion and yesterday's discussion, all of you have definitely an enhanced appreciation tomorrow once you get hands on that case performer. I also got some 2-3 case studies for a very interesting way of looking at presenting the case information very briefly. This was one methodology which was taught to me in my fellowship. I have done my fellowship in HIV medicine, I told you yesterday. That's the reason I came down from Nepal. Whereas I was working in a medical school as assistant professor in 2007, I came to Chennai because I got selected for that fellowship in HIV medicine, which is a 1-year residential program. So during that program, that methodology was taught to us how to write the case sheets and present our case sheets. So I thought like I'll share the same methodology with you also. Very interesting, internationally accepted methodology. Then I thought I'll just give you a brief introduction, one slide about the variety and the ways of taking a case history with embedded principles of communication skills. But later, when our time permits, we'll plan an in-depth session on communication skills itself. Then we'll summarize, and if you have any Q&A, we will talk about it. I always start my sessions with this particular, the transfer of training model proposed by Baldwin and Ford. On the left side of your slide, you can see the trainee characteristics, that is the background, the features of the trainee students or the participants or the learners like you. And what is the training design? What kind of format it is? Like yesterday, we had an in-person session. Today, we are having this online platform learning. So that is one input which goes into the training. And what is the work environment? Because today, though it is in virtual platform, ultimately you are in 25 days of internship period with the PHARM Foundation, and we are from Kairos Kinetic collaborating with PHARM Foundation. So this is the work environment. For at least for the kind of sessions I'm taking, the partnership is between PHARM Foundation and Kairos Kinetic. Later in the 25 days, you may be exposed to a lot of other partners and agencies. So that is cumulatively the work environment. So these are all the inputs you are getting during this trainee period. And the process for you to get exposed is what kind of learning and how much is being retention. Later, the outcomes, once you go back, how are you going to transfer this entire period? how are you going to generalize it and also maintain it. So this is not just for your MSW course period. Later, once you get your degrees, later when you enter into your jobs, professions, and also most of the learnings we do in academia, we also actually have a spillover effect into our personal life, right? So some of these principles we also bring into our personal life. When we have some application in our personal life, we also bring it to that. So this is how this transfer of training model. I always start my trainings and workshops with this model, because I believe in this model of providing inputs and taking care of the process of learning and retention. Retention is very important, because that's why I always ask you take notes, go back home and write a summary report or daily log, because that will enhance your memory and recall retention. Because whatever we are spending this 1 hour or 1.5 hours, it should have a long-term benefit in the form of outcomes. Now let us look into this introduction, because I pulled out some pictures for you which are available on the internet. There is this All India Association of Medical Social Work Professionals. So, coming from medical social work background, you are just second semester, but I wanted to alert you. Established in 2009, your professionals have an All India Association. So maybe you will take note of this. Just like for us, Indian Medical Association, all India level, we have an IMA where all the doctors are registered. We go and have updates, conferences, meetings, local chapters. So you can also check about this and see how it is operational, functional, and you can go and check out what programs, trainings, conferences, what kind of activities are happening. So that is one input I wanted to give you. And this right half of the picture will help you. These are all the varieties of social workers. Medical social workers, they do a lot of work related to healthcare sector, medical profession, medical medicine and medical issues. So you can see these are variety of images just to prime you. Your profession as medical social workers is so immensely documented in India. So let us quickly understand what is this medical social work. It's a branch of social work. Already in second semester, you might have heard it a lot of times, but I just wanted to start off with this definition. It's a branch of social work provided by social workers with an advanced degree. So not everyone can provide this, but you are going to have this degree, which is an advanced in nature, provided in a hospital or skilled nursing facility or hospice to the patients as well as their families who are in need of psychosocial assistance. That is the profile. Then what is actually medical social work? It deals with the problems of the patient, which are related to both physical, psychological environment, and also oriented towards assisting those people who during their treatment face a lot of social issues, physical, economic, psychological. So if you compare me and your profession, my profession as a doctor is strictly considered or constrained to prescribing treatment. Then I move on to the next patient. But your job comes after my prescription ends. You take the prescription, see whether the patient is getting the drugs or injections or pills or ointments. All these things is one thing, but you also try to see how you can assist them to face the social, economic, psychological problems associated with that health condition. That is why your job is more important, because my job is only giving ABC drugs, but your job is to see whether that ABC drugs are available, whether the patient can take that ABC drugs because of economic issues, whether the patient is able to understand psychologically that he has to take it in the morning, in the evening, 2 times a day, three different pills. So all that package is delivered by you. So you are doing social work in these components in a medical setting, and you have to use relevant social skills, because this is not just medical knowledge. You also have to bring social skills. That is why we are talking about communication skills, empathy, listening skills. You have to understand the society where you are working. Like if you are from Kerala, tomorrow you are posted in Delhi, you have to understand you are getting a job in Delhi. Your culture is different from Delhi's culture, but you have to adapt. So all these things, and the Delhi patients' culture is different, their language is different. So you need to develop relevant social skills and relevant knowledge, the language, Hindi language, to help the patients. So if you look at the history of medical social work, in 1880 to 1900s, that is early England period, there was this documented evidence that after mental patients were discharged from hospital, the visitors and nurses were asked to give advices to them. So this is the first kind of involvement of caretakers and nurses in this medico-social work. Later, a doctor by name Charles Emerson from America opined, that was his opinion, that whatever medical science is doing, it should also include the study of emotional and social problem. Because as I clearly told you, just giving a drug or an injection or pill is not the entire solution. Unless you understand the social and emotional problems behind it, that is not the complete care package. And he also suggested that medical students should work as volunteers in charities and agencies. That's why we always come back to institutions or NGOs like Farm Foundation, which are community-based organizations, especially working in certain focused areas like transgender upliftment, empowerment, healthcare, so that we understand what are their issues, and we gain knowledge, we gain learning opportunities, so that we can also work efficiently with this population. Then there is the sociologist by name Fink, who also said that life is a series of interruptions and recovery. So, all of you, if you remember the WHO definition of health, also, it is a state of physical, mental, social well being, and not merely the absence of disease. So, today we are not having uh, disruption, doesn't mean tomorrow it will be the same. It's not a static state. It is a state of ups and downs. It is a state of always keeping a dynamic change. So it is a series of interruptions and recoveries. So man is a unity of both mind and body, and medicine should consider this union. So we cannot only treat the body by giving some exercise, by giving some medicine, by treating blood pressure, but we should take care of the mind also. So physiology, chemistry, biology cannot alone or together explain everything related to illness. And these disturbances cannot be dealt with separately. So we have to consider them together as a single unit. This was the opinion given by this sociologist by name Fink. So with this kind of background, now I want you to reflect or think, okay, what is the nature and scope of my work or my profession, which is medical social work? So it is actually based on the assumption of the individual's dignity. So the person may be diseased, sick, or addicted, or mentally not well, but in spite of all these things, we should focus on that particular individual's dignity. That is why medical social work is guided and inspired by the basic values of social work. Just imagine Mother Teresa, the greatest individual, who is not even an Indian by birth. She left her country, came to our country, took care of people in Kolkata for so many years, established an NGO which is worldwide recognized for their charitable work. So that is based on the principles or values of social work. They are not expecting anything other than that from us. Okay, you are sick, we will take care of you. That is our work. So if you look at this nature and scope, according to medical social work, health refers to a state or condition in which an individual is capable to utilize all the capacities of his social living. So as MSW professionals, we let the individual realize that he can utilize all the capacities in his social environment, his family members, his social connections, relationships, the social environment, the friendships, the relationship with animals, the relationship with nature. If he can leverage all these conditions, he can maintain a status of health. That is the beauty of this concept. It's not just going to hospital, getting a pill, taking the pill, but you're not healthy. But if you maintain this connection with all these components in our social world, we will be better. So medical social work focuses on prevention, aftercare, social rehabilitation. That's what I have been repeatedly telling you. It's not just about the treatment phase. It is before that. That is, you want to prevent diseases. Suppose a patient gets a disease, after that also you want to take care. Suppose someone is having any kind of disability, whether physical disability, mental disability, or because of those two disabilities, he's losing a job, he's not having income. We will do all types of rehabilitation so that the patients have a meaningful and productive contribution in life. So when you look at this, uh, with all this background, you may be wondering, Madam is telling so much scope of my work or my profession. So what are the ways? What are my working methods? How can I do this medico-social work? As a student, I have to learn it first. Then tomorrow, once I become a professional, I have to do it as a part of my job. You may be employed in a hospital, as I said, you may be employed in an NGO, you may be employed in a charity. Wherever you are employed, you have to execute these working methods and continue that work. So what are these working methods? One method is case study method. That is what we are going to look today a little bit. And tomorrow or whenever we get our hands on this case sheets, we will look in depth, but today I will introduce you what is a case study method. Then there are direct methods of assistance. The social workers will directly provide assistance. Apart from studying the cases and giving a plan, they will actually go and assist them either through direct methods or indirect methods. So I will let you know what are these varieties. So what is a case study method? In this kind of approach, the social worker collects the information with regard to the specific needs of the patient, and then they will work towards fulfillment of that in accordance with whatever is available. Suppose a patient requires something, if that is not available, we cannot say, oh, that is not available, so let's forget about it. You go and keep on suffering about. No, that is not the approach here. So in this case study method, your job as an MSW professional is, we need to identify what is that one special or specific need. It should be very specific. It cannot be vague. Okay. Then along with the patient, we will try to work out a plan or a strategy so that we can fulfill that one specific need with the available means. Whatever is available, we will first map out. Okay, we have a resource 1, resource 2, resource 3. Within this available resources, whether we can fulfill that or not, that is called case study method. There are other methods like direct methods of assistance. They are, for example, social case work, in which the assistance is provided to the individual patient with the aim of developing his inherent capacity. So you will train the person, you will train his mental capacities, physical capacities, or even job employability capacities, so that you will work it as a case and keep on enhancing his capacities so that the patient will be directly benefited from this kind of work. That is social case work. Whereas group work, in this social group work, they will try at strengthening the social relationship, because the patient is never existing in this world as a single entity. He exists in a family, he exists in a community, he exists in a society. So, along with the patient, social group work includes strengthening the social relationships of the patient, and the medical social worker will work towards development of a healthy social environment. Suppose that particular patient is having a problem with his family, you will try to work with him and the family, understand what are the issues there, try to work on both sides. That is why it is called a group work. Whereas in the previous case, you are only working with that individual, identify his problems, and try to develop his strengths. That is a case work. Whereas group work, both the parties or multiple parties, you will try to work simultaneously. Those are direct methods. Now let us look into indirect methods of assistance. So medical social workers are also able to provide community organization, social administration, social insurance and social security measures, social action, social work research. If you do these kind of indirect activities, which can also assist either the patient or a group of patients, this kind of indirect methods of assistance is also part and parcel of medical social work. So let us look in depth what each of them are. What is community organization? If you are mobilizing or organizing the community resources with regards to health problems, that part of activity is called community organization. Suppose in that particular community, there is an issue with any health related problem. Say, for example, suddenly there is Now summer is starting, right? There is heat waves going to increase day by day. Today I'm feeling very headache from morning. To be honest, from morning I was feeling very suffocated. I told you yesterday, Freddie was asking, Madam, I'm having migraine. What's I told him yesterday, summer, sound, sweat. So sweat from morning because of increased heat. I was feeling sweaty, and there was no AC in the college for me. So from morning I was having headache. So when in a community there is any health problem, you can see what resources are there. Okay, summer is increasing, heat is going to increase. So in my hospital, whether adequate water facilities are there for patients to cool their body, whether shaded regions are there, what resources are there trees, are there shaded areas where people can sit during so like this, if you're organizing some community resources with regard to health problem, that is called community org. You can discuss with the management, sir, summer is starting, more patients are coming, they are not having sitting arrangements. We can think of putting some arrangements so that they can sit in the shaded areas, have lunch. Like that, you can do some organ. That is called community organizing. The other thing is social administration, where you guide the public opinion for enactment of new social legislations or amendments in prevailing legislation. So, as medical social workers, you think a policy has to be changed, a new policy has to be made, or an old policy has to bring with new changes. You can collect evidence, you can collect signatures from the target population, you can present that evidence to the local panchayat leaders or local MLAs and say, like, you can enhance that. That work is called social administration. The other thing you saw was social security and insurance, enabling the patient to utilize the facilities under social security and insurance. So, as a medical social worker, you can understand what are the benefits available for any vulnerable population, like widows or people who are victims of sexual violence. If you know certain policies or any benefits under social security schemes or insurance schemes, especially, if such a person is coming in contact with you, you can educate them. Because of your condition, I'm aware of so and so policy, let me help you to go and access that. So you can also do that kind of indirect assistance. The other thing is called social action. So how is that? MSW participates in the movements of social action at both national and international level. So a lot of international health days and national health days we celebrate. Like recently, on May 17th in our college, we are organizing World Hypertension Day. And similarly, if there is any national day like National Girl Child Day or National some other day, as MSW, you can keep track of all these things and you can mobilize. You can participate as well as involve your communities so that you can raise awareness. You can bring lots of involvement of the community, so that this is called social action. The other important thing for us as professionals is to do research, social work research. MSW inspires surveys, investigations regarding social, economic, and psychological problems. So, in your work, if you are seeing more patients coming with any unique problems, you can think like, okay, this seems like an interesting question. Let me do a survey. Let me go do an investigation, in-depth interview, do a study. This kind of work can contribute to research output. Then you have to document, then you have to publish. Then tomorrow, if I am sitting as an MLA or a health minister, I can see, like, is there any research evidence in this problem in my area? Then if your work is presented, is published, okay, there is this evidence that there is a health problem in so and so thing, so let me take some action. So research always helps to generate evidence, and currently the entire world is looking what is the evidence to address any health problem. Based on the evidence, budget or manpower or policies are made. So that is the background, students. So let me stop sharing here for a minute and ask you, do you have any questions in this content we are discussing till now? Anuja or Alina, Aishwarya, Vinita. Let us have some small interaction because I'm feeling like I'm only talking all the time.
No, ma'am. So everything is just uh,
You are able to follow?
yeah. We understood. Yeah.
Okay, fine. Then I'll continue with the presentation. So the case studies, as I said, I thought like you guys will be able to get a case pro forma from Nila and you will be able to go through it. And I thought I'll discuss that in depth and then come to this. But unfortunately, that was not the scenario. But if you recollect from yesterday, I already gave you a brief introduction how we first collect the socio-demographic characteristics of any patient coming to us, that is age, gender, uh, name, age, gender, then education, occupation, income, marital status, family size, then followed by the address. These are all commonly called as socio-demographic features. Then we will move on to the presenting illness. With what complaints? One, two, three major complaints: fever for 3 days, vomiting for 2 days, severe body pains for 2 days, like that very crisply we will capture the presenting illness. Then under the heading of history of presenting illness, we will go in detail. So fever for 3 days. So how did it start? When did it start? Is it associated with chills and rigor? Is it associated with any mosquito bites? Is it associated with any food intake? So like that, we will go in depth for every complaint. You said vomiting. What kind of vomiting? Is it like vomiting after food, or even without eating food, you are having vomiting? Because of the vomiting, you are unable to eat food. How many times in a day you are having vomiting? Like that, in depth, you will ask about vomiting. Then the other thing is body pains. So how severe are these body pains? Are you able to carry out your daily activities? Are unable to go to work? Are you always sleeping because of body pains? Like that, you will go in depth. That is called history of presenting illness. Then the next element is history of past illness. First, we will only ask about in the past 3 months, 6 months, did you have fever, vomiting, and body pains like this? That is what is history of past illness. After that, we will ask about the past history of any hypertension, diabetes, like that we will ask. Then, depending on the age group, if a small kid is coming, we will not ask about hypertension and diabetes, depending on the age group. Then we will ask about family history of any diseases like family history of diabetes, family history of hypertension. Also, whether anyone in the family is also having the same fever, vomiting, and body pains, or any other illness in the family currently because of the season or because of corona, like that we will explore the other history of family illness. Then, as I said, we will do some physical examinations. Because you're not doctors, you will definitely not do this part. Then we will move on to lifestyle habits, because certain diseases have a history of tobacco, alcohol, or other narcotic or substance abuse. So we will look into the lifestyle factors, physical activity, or what kind of nutrition, mixed diet or vegetarian diet, like that. Then we come to that family table. I told you, right? How many serial number, name of the family member, relationship to the age, gender, relationship to the head of the family, what is their current health status. Like this, we will capture some case pro forma related information. So apart from that, for today's session, I thought like we will discuss about this methodology called SOAP. This is the one which I was telling to you earlier when I was doing my fellowship in HIV medicine, which is 1 year program. It's an international program from CDC Atlanta. CDC is a Centers for Disease Control, which is an international organization from USA. It is after WHO in Geneva. This is the most important health organization at the global level, which will do world class or world level health surveys, health research, training programs, etc., etc. So the CDC Atlanta has a partnership or memorandum of understanding called MOU with government of Tamil Nadu, and they conducted this fellowship program starting from 2006. So in 2007, we are the second batch of students in this fellowship program. We are selected across India. In our batch, there were 17 students, and I'm the only student who is with MD community medicine degree. There were masters, MD clinicians, MBBS students, but there is no one with MD community medicine at that time in my batch. So it was a very, very uh, great experience. As I told you yesterday, I narrated to you how life-changing that 1 year experience was. In 2007, when HIV was at the peak in India, there were a lot of issues with stigma, discrimination. People were not getting adequate testing, adequate treatment across India. This one hospital called Government Hospital of Thoracic Medicine, it is in Krompet. It is Asia's largest 780 plus bedded hospital, Asia's largest TB and HIV hospital. So every morning we will go at 8 o'clock to our clinical postings. 8 to 1 o'clock we will have clinical postings. We will see patients. We will do OPD. We will be either posted in the OPD where we do all this kind of case sheets and everything, prescribing treatments, or alternative month we will be posted in the ward where, every in ward postings, one by one we will do the rounds. Then we will admit the patients. We will do the investigations. We'll go to the lab, get the reports, all that work, typical work. Afternoon 1:30 we will come for lunch, and then 2 o'clock to 5 o'clock we used to have theory classes directly from University of Washington through satellite sessions. Experts from University of Washington, America, and Seattle, California, everywhere from all these places, they used to take satellite sessions. So this is one session the clinicians and doctors, experts from America has taken for us, how to actually take a clinical case history in an internationally validated manner called SOAP. So you can see here S means subjective, O is objective, assessment, and plan. This we are, as part of our training, we have to do 20 such cases, SOAPs, and submit to our mentor. And every month we will have mentorship meetings. So in that they will review whether we are doing it well or not. And once in a month we have to present to the satellite session in US to the US teacher or guide. So this is a very great learning experience. So I thought like I will give you the same lesson what I learned in my fellowship in 2007 and 8, 1 year. So as you can see here, whenever a patient is coming to you with their complaints, that is their subjective interpretation of that disease or health related status. After listening to that, as medical professionals, objectively, we have to write down what is a problem there. With this objective assessment, we have to come to an assessment conclusion, right? After this assessment, we have to propose a plan. Okay, you came with a complaint in your own words. In my trained language, I did assess one thing. Then I'm giving you this plan. You execute the plan and come back. So this is what is called subjective, objective assessment and plan. So for example, in your social work, if a patient is coming, let us look into this example. Mr. Doe states that his daughter, Sally, still stays in her room on her smartphone and is withdrawn a lot. But the daughter has participated in family dinners, which is a positive step. So, Sally, the daughter, is also admits to feeling isolated, but she finds it hard to disconnect from her family. So this is the problem with which the father and daughter has come to the medical social worker, or a sociologist, or a psychologist, or a clinician, that is a psychiatrist. So once you look into this, this is the summary of it. It's not like the entire half an hour discussion here. You have to make it like a crisp statement after listening to the entirety. Then objectively, you are writing in your case sheet, Sally has been attending the family dinners without using her phone. Okay, though she is inside her room all the time, sitting with the smartphone and not participating, always withdrawn and all, but she's attending the family dinners. That is one thing which you have an objective measurement. This is the first session. Both father and daughters are coming to you, and they are not arguing about her screen time. They are just discussing the matter with you. They're not arguing with you. They're clearly told, father told one thing. Sally is also admitting. She's not arguing. She's admitting, yes, I'm feeling isolated, but I'm finding it hard to disconnect from my phone. That is what she's admitting. Now, what is your assessment as a trained medical social professional or a trained medical professional? From this situation, you're assessing that, okay, Sally is making a progress. Okay, she's making a progress. That means she's at least able to keep the phone away in her room and come and participate in the family dinners. Okay, so at this point of time, it looks okay. But what is your future plan? She's actually provided a task to turn off the phone for 30 minutes earlier at night. Okay, you are coming to the dinner is another 30 minutes. Apart from that, because she said no, she's having difficulty in disconnecting from the phone. Now you are giving her a task. Okay, Sally, we are going to have a plan for this. We are asking you from the next 2 weeks, after dinner, after going back to your room, please turn off your phone for 30 minutes earlier at night. Suppose you are going to sleep at 9 o'clock, switch off your phone by 8:30. Don't use your phone till 9 o'clock and sleep. If you can do this for the next 2 weeks, then we will be meeting again next week and you have to come back with this activity sheet. So this is how we will document a case from their perspective and from your perspective objectively what is actually the issue here and what is that you have assessed here and what is the plan you are proposing. This is one example. SOAP. Now let me look at one more example for your benefit. Joseph subjectively feels anxious whenever he's leaving his home, but he is feeling better. He's doing better. He still has panic attacks when he's around too many people. And he says he's using mental visualization and those tips are helping him. This is what he's telling you. As Joseph, this is all the thing he told you. Now you are an MSW professional. So what is your objective understanding? So Joseph is more relaxed than he was, right? That is what he meant by doing better. And he also successfully visited going out, right? He's successfully visited grocery store twice in the past week without experiencing a panic attack. That's what he's telling, right? This mental visualization tips are helping. So that means he went to a grocery store in the past week in the 2 times and he did not experience a panic attack. That is what you understood from the conversation. Objective. Because in objective way, you have to measure 2 times in the past week without a panic attack is a measurement. Also, more relaxed than in the past is a measurement. That is called objectivity. Then what is your assessment? The progress being made by Joseph is slow. Only 2 times in the past week he's had no attack, but he achieved at least one of the 3 goals, which you discussed in your previous session. So that is slow, but some progress is there. So what is your plan? Joseph's visits are being increased to twice per week so that you can improve his progress much more faster. So this is how you are making the plan based on the progress of Joseph as he discussed with you and as you objectively measure the progress. So this is subjective, objective assessment and plan strategy in the case of Joseph. Now, let me quickly take you to just one more example so that you will get much more practice into this. Elaine is still feeling very depressed and isolated. She states that occasionally, she hears voices, but I cannot make out what they are telling me. She doesn't like the side effects of her prescribed medication, but admits they are helping with her symptoms. So this kind of hearing voices is typically a mental health condition called schizophrenia. This is what this is typically, and they will be definitely prescribed medication. They will have some side effects, but they will definitely help with their symptoms. So after this kind of description by Elaine, you are objectively looking at her, assessing her, clothing looks unwashed. That means she is not taking care of her. Her appearance is also disheveled. That means her hair is not combed. She's not looking neat and tidy. And she's speaking in rushed fashion, hurry-burry fashion. So your assessment is the lack of progress is very concerning to you. Though she's telling her symptoms are improving with medication, etc., etc., just by looking at her, you are assessing that progress is not really up to the mark. Also, her auditory hallucinations, as I said, it's a key indicator of schizophrenia is still present. Though she's telling her symptoms are coming down, that is her assessment, but objectively, you're not seeing any such indicators. So, what is your plan? Medication is being changed, and the next session within 3 days, you just want her to come back because you're changing her medication, right? You want to see whether there is any change, any improvement, any bad improvement, or deterioration, or whether she's having any other issues. So, you want to assess very quickly. So, within 3 days, you're asking her to come back for quick review. So these are certain examples. So this is the template for you students. Whenever we are attempting to take SOAP notes, first you can write the client name or patient name. What is your assessment data? Who is submitting these notes? It is Dr. Sree or Freddie or Alina. What is your professional credentials, whether you are a doctor, whether you are MSW, whether you are psychiatrist, MD, MBBS, whatever. We have to write all that. Then just like what I have discussed with you, subjective, that is the client's description of the problem. Whatever words, whatever language, whatever phrases the patient is using, you have to take down the notes in detail. That will give you the clues. Based on that, you will take the objective part, that is objective observations of the client and the problem by you. 2 sessions or 3 minutes, that kind of objective assessment by you. First one is only in the plain language of the patient. Second is your observations of the client and the problem. Then assessment, summarized assessment of the problem along with the proposed plan. That is called the SOAP. So this is how you approach this. Writing a SOAP notes means following that format, beginning with subjective, you note that, followed by objective, followed by assessment. Planning is very important because based on this, next time, because you see hundreds of patients, you may not remember everyone. Maybe you will remember Sree. Maybe you can't remember 100 patients, right? Some of their patient complaints could be very minimal. For them, it is major. But for you, in the scheme of things, it may be a common problem. So you may not remember everyone. So if you remember all this SOAP format and write out for that particular case, what is the plan? You have to come back in 3 days. I'm changing your medication. You have to do this, do that. Next time when they come, you can pick up from that. And when they are describing, you can correlate. So this is how you have to take the SOAP notes. So when you are interacting with all this background, what is more important, as you know, communication skills. And especially the kind of cases, the kind of medico-social work mostly related to social aspects, economic aspects, psychological, emotional things, the communication skills are very essential because the patients come with a lot of anxiety. So today I'm just going to introduce you in this angle how a medico-social worker can start the communication skills. First thing is, whenever a patient or a client comes to us, we need to start with decreasing the patient anxiety. Okay. Let them be seated comfortably, offer them a glass of water. If they are coming from sun, let them relax, mop their sweat, take a deep breath, 1 or 2 minutes, let them relax. First thing is decreasing the patient anxiety, making them feel a little bit comfort in your presence is very, very important. Then you ask for permission to gather specific information that could improve their care. This is very important. Sometimes it will be very personal, very intimate, very private, very confidential. So we need to ask, sir or madam, we are asking this for information so that we can help you. We can improve your care. It's not like we are invading your privacy. We are probing your private information. This information will help us to understand and improve your care. And as I said, if there is a confidentiality issue, suppose there is some sexual abuse that is causing trauma, that is causing depression, that is why the patient is behaving something like that, we have to definitely address them appropriately. Sometimes when the parents are sitting, or elderly caretakers are sitting, adolescents or children, or they may not open up. So we need to get those dynamics correctly and address them appropriately. Otherwise, parents will not bring them next time, right? So we need to, you will learn this slowly, when you gain professionalism, when you gain more experience, when you see more cases in the presence of your supervisors, what is culturally appropriate, what boundaries you should not cross, you will learn them. But whenever confidentiality issues are there, please address them appropriately according to your teachers or elders guidance. Keep questions professional, okay, but understandable. Because it is professional, you cannot use medical jargon, right? Don't put your technical content, technical language when you're talking to patients, but it should be professional. For example, here, don't use the words like illicit drugs. Illicit is a very technical term. We know what is illicit drug, but the patient coming to you using street drugs, recreational drugs, they will not understand this illicit language. So you should use the word street drugs. What is available on the streets? Are you purchasing drugs from the streets? Are you using a recreational drug? Like that, you have to make them understand what is the question, but not use too much technicalities. One most important thing is always ask close-ended questions so that they will answer very specifically, right? And they offer, and you can also offer yes or no, like that. For example, I'm giving you here. Suppose you're asking a client about a cocaine use or illicit substance use like this. Do you use cocaine? Yes or no? There is nothing like in between there. Yes or no? How often do you use? Is it daily, weekly, monthly, early? So that the client will offer a response. Yes, sir. Yearly once when I meet friends. Like this response will come. Don't ask open-ended questions and leave them to, build a story or a script or a movie. Okay. Ask for pertinent history, which is like what is the frequency and duration. Yesterday also we discussed. When we are using some kind of narcotic or addiction related history taking, we should be very specific. Have you used tobacco? How often you are using? On a scale of 1 to 10, how likely are you to quit? Suppose 1 means I don't want to quit. Never I want to quit. 10 means immediately I want to quit. Like that, you explain what is that rating 1 to 10. Then guide the patient to choose the appropriate according to his mindset. Don't put your words in their mouth. 10, right? You want to quit now, right? 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 Okay, 10. Don't do that. Please don't do that. You ask them, give them a choice, give them a time. They are not intelligent like us to make immediate decision. They know how deeply addicted or superficially addicted, how strong they want to quit. So let them decide slowly, but guide them. Next, normalize the problem by saying a generalizing statement. This is very important. We also discussed this yesterday. We cannot be judgmental. We cannot do stigmatizing to the clients because we are in a superior position. For example, we should tell them, sir, madam, these are routine interview questions that I ask all my patients. Like, how often are you smoking? Do you consume alcohol daily or weekly or month? These questions are routine. I ask all my patients. Okay. By doing so, the patients will feel, okay, this is not that I'm looking like this, like an alcoholic, this madam is asking this question. Okay, this is routine question they are asking everyone. So then they'll feel comfortable and they will be more interested to talk to you and share them. That's what is called trusting and rapport building. Otherwise, they'll say, okay, she's judging me just because I'm looking like a alcoholic person. That is why she's asking me. No, we have to tell them in the beginning itself, sir, this is my work profile. So this is how I will ask all my patients. So please do not misunderstand me. Like that, we have to explain to them. So this is the summary, students. I hope it helped you to understand what kind of work, social work includes, what is the scope. I did not want to bore you because you're already in second semester. You know what is medical social work. You have syllabus, you have curriculum, you have classes. But in general, when we see MSW students in medical hospital, they come for postings. We just give them some introduction so that they know what is their scope of work. Then especially for case studies, this is one format I find extremely useful as a medical student, SOAP. The more you practice, you get a hang of it. And tomorrow, if at all, Neela, is able to get hold of it. Otherwise, I will get hold of it because I'm a doctor. I can get it in my hospital. I will try to send her a copy and she will share with you so that you can go through that and you will understand typically in a clinic how a case history is developed. That is for doctors or nurses. But the same will be applicable for medical social workers, students also. But your job, as we discussed, you focus more on the social, economic, psychological, emotional aspects in depth, which those professionals do not address. They will give treatment and doctor moves on. Nurse comes and she will give, okay, this tablet, that tablet, this tablet, morning. But you will come, you will understand why the TB patient is getting TB. What is his economic condition? What is his occupational condition? Does he need a job? So all this background you will learn in depth. Now, I would like to summarize that today we have discussed about this background and some case performers as well as a basic insight into how communication skills should be targeted to this group of patients so that going forward in our next sessions, you will gain more in-depth understanding about this. So with this, I will conclude my session for today. And I request if you have any questions, we can definitely address them for the next 5 to 10 minutes. Thank you so much for your patient hearing. Vinita or Anuja or Aishwarya, Alina or Freddy again. If there are any questions, we can take the questions.
Ma'am, can you please summarize that subjective objective assessment?
Yes, I will do that.
Subjective to objective.
Yes, SOAP is subjective, objective, assessment, and plan. So, subjective is the client's version of his story or his complaint. Whatever he is coming, sitting in front of you and telling, that is his subjective. The way he's experiencing, sir, I'm having anxiety, sir, I'm having depression. The depression is making me feel like this. The depression is making me not eat food. The depression is making me not go and meet my friends. Because of that, I don't feel like doing anything. I don't feel like attending college. Like that, whatever narration the client is telling to you, his observations, his experiences, his feelings, his health related behaviors, that entire thing is called subjective. When you are listening to that as a healthcare provider, you are objectively listening to that. Okay, apart from that story, in that story, there will be some key elements. Okay, since 3 months, this is going on. Because of this depression, he's not eating food. He's not taking 3 meals a day. Because of that, he's going into undernutrition. Because of that, he's not attending college. So his academics is affected. So like this, some measurements you are also capturing. That is your observation, objective assessment. You're assessing objectively. Measurements, assessment is coming into these two headings. Simultaneously, you are putting, whenever he's narrating the story, in these two template paragraphs, you are writing objectively, okay, 3 months, that is one measurement. Assessment is not eating food, not attending academics. This is your assessment. So then plan. After this description by the subject is over, you will tell him. So if I understand you correctly, this is going on for the 3 months. In the last 3 months, you did not attend any healthcare session. You did not meet any healthcare professional. Like that, you will confirm. Okay, this is your first session. That is one more assessment plan. Then the next thing is you are not eating 3 meals a day. Am I correct? Okay. Because of that, you have lost weight. Okay. Because of that, you're having mood swings. You're not feeling like before. You're not feeling good to meet your friends. So this is assessment, assessment, assessment. You're assessing all these things. Then you finally arrive at a plan. So what is that you want me to do now to help you? He may say, sir, I want to feel better. I don't want to be in this depression. I'm afraid I will do something. Like what? Maybe he's contemplating suicide or whatever. We need to go in depth and then we will have a plan. Okay. Now that you are telling that this is a serious issue because you are thinking of suicide or thinking of something, like, we'll have a plan. The plan is, you please come daily for a health counseling session, because suicide is a big issue. The kid may go back or the client may go back and do something. That is a suicide. Someone even expressing a word and thinking of suicide itself is calling for help. They are asking for help. Immediately, we can't say, no, 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 you will not do anything. For the last 3 months, you did not do anything. What will you do now? Like that, we should not talk. Immediately, we say, okay, let us do something now. It's very helpful for me that you had this discussion. I'm right here to help you. Let us have a plan together. What should we do together? So tomorrow, where are you staying? Are you staying in a hostel? Do you have a roommate? Okay, let the roommate, do you want your roommate to be involved? No. Okay, then I will be your partner in this. Let us plan together. This is my mobile number. You can call me because suicide is a big deal. You can call me anytime. So this is the plan one. You can call me if you need help.
I mean, in between.
Are you joining again?
Yeah, yeah. We already understood that thing.
Yeah. So together we can make a plan in the case, so that the plan is, you can call me when you require help. And the next plan is, at least whether you like it or not, you have to eat breakfast, you have to eat lunch, you have to eat dinner, because nutrition is directly linked to the positive mood. In that breakfast, you can eat a good fruit. In that lunch, you can eat something good. Like that, we can make a plan. So subjective is the entire story told by the patient in his own words. Assessment, objective is what you are deriving from that story objectively, so that there will be some clues like, oh, since 3 months there is a depressive episode, he's not eating 3 meals a day. Like that, some objective scores will be there. Then the assessment is what you are assessing from this situation. He's severely depressed. He's isolated. He's not meeting friends. Like that, you are assessing. Then the plan is, let him get adequate nutrition. Let him have contact with you, because he needs, because he's totally isolated. He's having suicidal thoughts. So 1, 2, 3, 4 plans and daily counseling, so that in the next 1 week you will support him, so that the kid will feel, or the client will feel supported. So that is called a subjective objective assessment plan. There are a lot of examples, as I'm sharing this presentation link tomorrow or after today's session. I will send the PPT to one of you, or Nila, so that she will give you the PPT. You can read it. That website is there. You can go online and check out. So that is the summary for SOAP.
Okay, man. Thank you.
Great. If you have no further questions, you can keep reading about the content we talked. And in future, because from tomorrow till Monday, I will be very busy. I thought Saturday we can do something, but I just have another engagement. I have to take my mother to the hospital on Saturday. So probably next week, we will plan some sessions online, because Zoom session we can plan as usual, like this today, 3:15 to 4:15 or something like that. I can talk to you more once I get the case sheet. I'll send it to you so that you can prepare. The next session, we can either discuss the case sheet or we can discuss the communication skills in depth. Is it all right?
Yes, ma'am. Yes, ma'am.
Yes, great. Thank you so
Thank
much.
you, ma'am.
Thank you. Bye bye. Take care.